Hello, my name is Dr. Drew Moffitt. I'm Medical Director of Arizona Reproductive Medicine Specialist. In this presentation, we're going to be talking about COVID-19 and infertility treatment. Is it safe? In this series, we're going to talk about what is safe, who is safe, and where is safe. Now, at the very beginning, we need to say that this is what's called a novel infection, meaning this particular virus has never infected the human population before. And because of that, our understanding of the disease is rapidly changing. New information comes out and we need to update our thinking. But there are some areas where clear conclusions are emerging, and throughout this series we will highlight them. In this segment, we talk about where is safe. Specifically, is the infertility clinic safe? We talk about transmission between people, transmission from surfaces, and transmission from the treatment itself, specifically talking about inseminations and embryo transfer. At ARMS, we're doing everything we can to keep our patients and staff as safe as possible. Before the first community-acquired cases in Arizona, ARMS had in place policies, procedures, and equipment that exceeded CDC guidelines. Long before the CDC decided it was a good idea, ARMS adopted a comprehensive universal masking policy. What that means is that everybody in the office, both patients and staff, are wearing a mask. Now, this type of mask doesn't protect you from being infected by another person, but it limits your ability to infect another person. When everyone in the office is wearing a mask, everyone is protected. To find out more information about universal masking and the evidence that it works, you can view my video on the topic called COVID-19, A Tale of Two Cities on our YouTube channel. In addition to universal masking, we practice temperature monitoring of all patients and staff. We have a patient flow management system to exceed social distancing recommendations, which includes the use of telemedicine so that you can have your visits in the comfort of your home. Patients only are allowed in the office to reduce the number of people in the waiting rooms, and we have a clinic flow optimization strategy to achieve maximum patient separation. Though transmission of virus from surfaces is less likely than previously thought, ARMS takes the following precautions. Surfaces and patient flow areas are disinfected periodically throughout the day. Hand sanitizer dispensers are positioned throughout the office, and all patients and staff are encouraged to clean their hands after touching any surface. High contact surfaces, such as the doorknobs of bathrooms, are disinfected between each patient. And all exam room surfaces that the patient comes in contact with are disinfected between patients. We also have protocols in place to reduce the risk of transmission from the treatment itself. For inseminations, though partner transmission already exists, to reduce the risk of sperm transmission and other procedures, partners are first tested negative for COVID-19, and then their sperm is frozen for future use. In order to increase the safety of embryo transfer, females are tested for the presence of virus at multiple times during an IVF cycle. Only embryos created from sperm and egg sources that tested negative for virus are stored at ARMS. All other embryos are stored off-site. In summary, though no place can guarantee that your risk of contracting COVID-19 is zero, ARMS feels that through the use of strict protocols to limit transmission between people, transmission from surfaces, and transmission from the treatment itself, ARMS has reduced that risk to well within acceptable levels. In summary, in previous sections we talked about what is safe, concluding that infertility treatment is probably a lot safer than other things we feel comfortable doing. We talked about who is safe and how baby and mom are probably very safe in this procedure. And finally, in this segment, we talked about where is safe. Specifically, ARMS is a safe place to be. Thank you very much for watching this presentation. I hope you enjoyed it. If you did, please share it with someone.